This is the Second Chance at Health podcast. I'm your host, Dr. Brad Hassig. Come join me as we remove confusion from the hottest health topics by discussing the latest research, along with what we've seen with thousands of our patients and amongst our community, family, friends, and people all over the nation and world. Let's dig in. Hey, this is Dr. Brad Hassig with the Second Chance at Health podcast. Today's episode number 23 is Coming Changes in Healthcare. As always, please subscribe, like, and share this with your friends. Today's Bible verse is Galatians 6, verse 9 through 10. Let us not become weary in doing good, for at the proper time we will reap a harvest if we do not give up. Therefore, as we have the opportunity, let us do good to all people, especially to those who belong to the family of believers. We've recently here just had an election. Some people are happy, some people are sad, but almost everyone is glad that it's over. But from a health perspective, what kind of changes can we potentially see going forward? And I love the fact there's a lot of non-political, bipartisan agreement on changes that need to be made. This is a time potentially. There's a lot of people that we all need to hold accountable. Things that were promises made, suggestions that were discussed. We need to hold these people accountable. Finally, I'm optimistic, more optimistic now than I've been in a long time in terms of potential changes, and not just ideas or concepts, but we're talking about agency changes. I'm one of the things that I'm very excited about is listening to, I've discussed Casey and Callie Means, RFK Jr., and I don't care about his personal social politics, anything, just put that stuff aside. What I care about is a lot of the things in his passion, no matter where you're at on things, his passion for health, and that guy's on a mission, and I'm really hoping that he has the ability to influence some of the things that have been discussed in complete overhaul and changes in the FDA, the USDA, Health and Human Services, the CDC. It's so in talking about food, just in the foods we're eating, the regulations with that. You have to look at the influence that those agencies have on public health, food safety, and nutrition in general. You go back and look at things, the food pyramid that we grew up with. And even as a kid, I thought it was crazy, the level of grains. And I'm trying to think if it was 8 to 12 or 10 to 12 servings of grains per day. And as a kid, I thought, man, this doesn't seem right. Yes, I love cereal, but how can this be healthy? Well, it wasn't. As a child, you're young, you're naive to the agendas of groups and corporations and the influence that they have over government agencies. There's so many just regulatory delays, good ideas that different administrations have had. Then obviously the influence from corporate interests. So we really need to look and see and I guess be hopeful for and hold people accountable to, to making some meaningful reform. It could improve, the consumer protection, food safety, and public health outcomes overall. Getting a lot of the, we'll talk about getting chemicals and things out. So one of the things that when you look at some of the advocacy work, whether it's RFK Jr. or some of the other people, there's focus on regulating those regulatory bodies. The influence that we could see with this is improving transparency in those groups. There's just so much conflict of interest, so many people that bounce between corporate entities and then work for those government agencies. and direct influence with those. So we need to look at, like I said, conflicts of interest, especially between the food and the pharmaceutical industries. I've talked about this before, but now's the potential that we could see some significant change with this. We need implementation, stricter guidelines with safety, the approval process for chemicals, additives, hormones used in the food. We need to get a lot of those things out. I just saw things with some of the red and yellow dyes, the potential for things, but I don't want to talk about things in 20s, 30s. This is stuff that we could get in. That if they can shut down a pipeline, they can shut down some of these food and drug companies on certain things and chemicals. Let's get serious with this now. Whether it's a swipe of the pen or a different person that's monitoring these agencies. This stuff can happen. I'm tired of them slow walking the stuff that's going to affect our health. And let's continue to put pressure on people. We're sending people on both sides of the aisle to DC, and that's where a lot of these changes are going to take place. There's no reason that European countries should have healthier food than we do. To have drugs that prescription drugs that are not allowed to be sold in Europe, but those European countries are selling it to us. We're tired of being their guinea pigs with things. So we can end those things. Get regulations on those particular items. But to get the chemicals out of the food, to get a lot of the GMO stuff out of the food, so much of the digestive disorders that we're seeing, the chronic inflammation, the metabolic disease that I see with patients every day, a lot of this stuff could be eliminated if we had regulations on the chemicals, additives, hormones, and things that are in the food, GMO things that are in the food. When you're looking at this, the effects of these things, you're looking at hormone imbalances, like I said, inflammation, chronic disease. It's having discussions with patients, family, friends. You can see, and it's not just a weight thing. It's not just inflammation. You see chronic sinusitis. You see things like eczema, skin conditions. There's a lot of things that your body is trying to get the chemical crap out of your system. And it's even better if we didn't have it in there in the first place. So I am super excited, with the potential of what's going on with this. Like I said, the effects. There needs to be more regulation of those foods, of those companies. A lot of it is going to be getting in, and like I said, with USDA, the FDA, with our food and our drugs. If we can get people that have our best interest in mind, to have healthier foods, especially with the kids. I am sick and tired of, I saw a thing, and I was listening to it, and I was reading about, they were one of the food companies was wanting to have Lunchables, and I think it's Kraft was the company, and if it's not, Kraft does plenty of bad stuff, so I don't mind mentioning their name. But they were wanting to have Lunchables in all kids' school lunches across America, and it's sad to me that purely from profit, because they could tell you how many billions of dollars of profit they were going to make by doing that, and how much it was going to cost them to pay certain people to get that put that food order in across America for our kids, how much it was going to profit them, but how sick it was going to make it. And go figure, when kids are younger kids now are starting to become type 2 diabetic. And then we get into the whole Ozempic thing, where they want them to have to, kids having to, when you're starting to have that type of metabolic disease and type 2 diabetes in younger and younger ages, let's throw them on things like Ozempic. It's systemic, it's sick. But I'm cautiously optimistic. This is one of those times. I'm a pragmatic optimist, but this is one of those times I think we can be a little excited about this. Let's hold people's feet to their fire with this. we need to look at things, promoting natural and healthier food options, and bringing the cost down on those items. It's sad that they put so many regulations on farmers, whether it's organic fruits and vegetables, whether it's grass-fed, no hormone, pasture-raised cattle. It's sad that they put regulations on those people to make it more and more expensive so that we don't have access at a cost-effective price with inflation right now. But it's not an accident. This is all by design. So I'm super excited about that. We need to look at advocacy for organic and sustainable agriculture. Why the benefits to people, to the food, but to the land too. I think this message goes to everyone across all political spectrums. This isn't a political ideology. This is a health ideology. And I love it's a faith ideology. God wants us to be healthy. There's nothing I can't imagine he's excited to see the intentional sickening of our population, especially in our children. It's just, if you're an adult and you want to eat junk and get sick and have, different, systemic diseases, metabolic disease, earlier onset of death, and a lower quality of life. If you choose that that's your choice. But for the kids, they don't understand, or for people that aren't able to be as educated on this, the commercials for pharmaceuticals, commercials for a lot of the junk. That's another thing. That's something that can be wiped out day one, early on, to get the drug companies off of all of our commercials. So, there's challenges and there's opportunities for to increase consumers' access to healthier foods. There's economic things, obviously, regulatory things. It's not going to happen overnight, but it can happen a lot faster. I'm tired of them slow walking the things that are beneficial to us, where they change things with a swipe of a pen or a vote in the middle of the night that affect us and affect our health. So we'll talk once again as we're doing this, what we can do is, and I'm not going to advocate for any specific diet. You go back, watch some of the different episodes where we talk about those things. Look at whole foods, the importance of whole foods. When you're looking at ingredient lists, one of the easiest things is you want as few ingredients in there as possible. If you see things that you can't pronounce in 30 ingredients in a food, stay away from it. And I'm hoping once again that some of that gets changed. You want balanced nutrition. It doesn't have to always be carnivore. I'm a big advocate of that, for an elimination diet for periods of time. But let's get a little more balance in terms of what we're eating. Obviously, you don't need 10 to 12 grains, especially if it's it's cereals, Fruit Loops, Lucky Charms. You don't need 10 to 12 bowls of that a day. Tying in with that, minimize your processed foods. Get a lot more whole food, fruits and vegetables. If you're going to have grains, things like that, look for local things. Look for, if you're going to have bread, look for something sourdough, local, heirloom grains. Look for people that are trying to make this homemade. It might be right now, and I get it. We all do what you can afford. Eat the healthiest stuff you can afford. We're all hurting with that right now, and hopeful for some changes in that direction. And then look at functional nutrition. That's one of the things. That's why I'm so passionate about what I do. I'm hopeful for the day that you don't even need it. I would love nothing more than if doing a lot of that was completely unnecessary. For years, nutritionists would say, oh, you can get all your vitamins and minerals from your diet. If it was the early 1900s, maybe, the textbooks were old, outdated, or they just had bad information, because you absolutely cannot. With soil depletion, with the additives, the chemicals, the pesticides that are in fruits and vegetables, you absolutely cannot get all of your fruit vitamins, minerals from your diet. So there's a place, obviously, for now. I look at my perspective is I want to help people heal as naturally as possible so they can absorb their food, absorb their vitamins, minerals, as well as possible, because with digestive disorders and metabolic disease, the things where it affects sleep, hormone imbalances, things like that, all of that people cannot even absorb, even if you had the best foods right now. If it changed overnight, a lot of people are sick. We're all to a certain degree sick. The inflammation, the effects to our guts where you can't absorb, we're malnourished by design, because guess what? Then you're going to need a cocktail of never-ending drugs, a longer list of that. So look at those natural nutrition-based approaches to things. That's why that's one of the reasons I love Standard Process. It's food-based nutrition. They've got the best herbs, MediHerb, they have the best herbal company in the world, but the food-based nutrition with Standard Process is amazing. And that's what I tell people in consultations. Anyone, set up a consultation with me. I can go over it. We can use testing. There's different types of testing that you can do. If not me, somebody else. I don't care who. It doesn't matter. But make sure that you're getting a good nutrition program, and then whatever functional nutrition, vitamins, supplements, spend your money on good stuff. Don't waste it on, I'm sorry, Costco, CVS, Walmart. You're buying crap. You're throwing your money away. Instead of doing that, it's worth it, whether you're talking to me or another professional that has advanced training in this, has your best interest in mind, that can come up with a sustainable program for you to get you healthy, help your body heal, and then have something ongoing down the road that's going to allow you to thrive. I'm tired of, just surviving. God wants more for us. God wants to bless us beyond anything we can ever imagine. He wants to find favor on us. But he's giving us ways. He puts people in your lives that can help guide you on that journey. So, I wanted to keep this relatively brief, but I'm excited. I'm optimistic about the potential for some changes that we can have. But I ask people, hold the feet to the fire. These individuals that are in power with this, this is the time. I want as many people to get healthy as possible. Watch your video, share it with your friends, subscribe, like, but put this into action. Put some of the things that I talked about into action. And as these changes, the biggest thing, we've been conditioned to act and purchase certain things, to eat certain ways, we've been conditioned to a sick care system instead of healthcare. It's not healthcare, it's sick care. But there's the potential to have this. As these changes take place, be willing to change. Look for that change. Adapt to the hopeful changes that are coming. I think there's great things on the horizon. I'm excited for this, and I'm excited to see where this can take us. Take care. Have a great day.